March stands for Maternal, Adolescent, Reproductive and Child Health, and we are more than 150 world-leading scientists focused on the issue of women's and children's health from Afghanistan to Zambia, all around the world. Because March focuses on pretty much everything except the adult man, we want to have particular themes that help us to effectively bring together multidisciplinary teams to address the biggest issues within women's and children's health. And those issues we have focused around A, for adolescent health, the world's biggest generation ever of adolescents, critical issues particularly for girls in the future of the post-2015 world. Then secondly on births, family planning, reproductive health services, births that are healthy and safe both for the woman and the newborn. And then thirdly, children. So child health, nutrition and child development. So these three themes, A, B, C, are the way that we organise both our research and our leadership development here within March at the London School.
Of course, much of the work by the members of March would carry on irrespective of the centre, but I do think that our centre adds value. So because we're organised under three themes for adolescents, wanted and healthy pregnancies and births, and child health, all of our members can find a home for their thematic area. But as a centre, we really try to focus on the synergies between these different themes and put a lot of emphasis on the importance of health in the context of the life course.
Why is adolescent health really important? Well, for three main reasons. The first is that there's a demographic transition in the world. There are now increasing numbers of adolescents relative to young children because young child mortality has been plummeting throughout the world, both in high-income, middle-income and low-income countries. And fertility is still declining. So there's the largest number of adolescents that there has ever been in the world today. Secondly, because of the epidemiological transition, that infectious diseases have been plummeting, especially among young children, whereas there's been an increase in non-communicable conditions, so things like injuries, mental health disorders, diabetes, heart disease, and so forth.
So the other thing that is important in terms of the adolescent and young people theme, and in fact in terms of the March Centre in general and all of our public health work, is trying to use insights from different disciplines. And so obviously in public health we're often talking about behaviour change interventions, for instance, and so we might need to know about why people behave the way they do, but also maybe the effect particular medications have on them, or the types of technologies that we can use to help make people's lives better.
The birth theme involves the preconception stage of life, fetal development and safe delivery. So it inherently involves maternal health as well as the unborn and developing child. It encompasses as well general reproductive health, family planning services as well.
Our team involves more than 100 staff and doctoral students working across the school in the 3 faculties. We have 3 faculties at the London School. Every year we are as well joined by MSc students who are very enthusiastic about our activities and the topic.
We've done really well, I guess, in terms of in the last 20 years there's been a dramatic decline in under 5 mortality, but still there's a lot of unnecessary deaths. So there's like 1 child dying every 5 seconds, 6.7 million per year, and over half of that is in the first month of life. So particularly in newborn survival, we still have a lot of work to do. And then beyond survival, it's not just about survival. It's about children reaching their full potential in growth and development, and through into adulthood.
New research shows us that our health is determined not just by our own life cycle, not even just by the life cycle of our mother, but intergenerational. And this new science is critical as we go forward past 2015 and into the new goals and targets when we want to accelerate progress, not slow down. The March Centre, with interdisciplinary scientists, is well placed to advance that science and make the biggest difference for improving women's and children's health around the world, both in research but also in leadership development. We hope that you will join us and help fulfil that mission.